New updated guidelines encourage early treatment for children as young as 12, including medication and weight loss surgery for those as young as 13. These guidelines say it can reduce the risk of developing other health conditions when it comes to childhood obesity. And the recommendation comes as obesity in children continues to rise over the past decade and a half. Obesity now affects 20% of kids and teens here in the U.S. and more than 40% of all adults. Dr. Archana Sadhu from Houston Methodist Hospital joins us live. Dr. Sadhu, thank you for giving us some of your time here. These new guidelines, are shocking to some people, recommending drugs as a tool to fight obesity for kids as young as 12, surgery for kids as young as 13. Seems to be a pretty dramatic escalation from, the previous protocols. Do you think the science backs this up?
Yes, I do. And that's exactly why these protocols have been escalated, as you mentioned. A previous approach to childhood obesity was more of a watchful waiting and, of course, trying to intervene with lifestyle changes. However, we now have great randomized controlled trials and long-term data showing that early treatment does result in long-term benefits. So that's why the escalation in recommendations so dramatically in these last 15 years.
Doctor, we see that, obesity among children and adults has increased. So are these guidelines realistic? I mean, can people actually do this? Will they do this?
That's a very complex question to answer. We are fortunate now to have these new classes of anti-obesity drugs that are very effective. So in that sense, yes, it is realistic. And yes, we will achieve the weight loss that we need to prevent the long-term complications of obesity. And that includes type 2 diabetes, high blood pressure, high cholesterol, heart disease, fatty liver disease, and even psychological detriments to patients. So in the medical perspective, we do have the treatments available for that. However, it's going to take more than medications to really solve the crisis of obesity.
Absolutely. And doctor, that really takes me to my next question, because people hear medication, they hear surgery, and that seems pretty scary. Does there need to be more focus on what is causing this increase in obesity in American children?
Absolutely. Absolutely. It is very disheartening and disappointing to see that we've come to this point where we have to do dramatic solutions like medications and surgery in our children. So we have a lot more to do from the day they're born in terms of how they're developing in this environmental in our society and with the environmental factors that are contributing to their obesity, as well as the social factors that are contributing to obesity. So a lot more to be done to prevent obesity in addition to treating those who succumb to it.
We don't have much time left, but I do want to ask you this. This report also focuses on changing the perception of obesity. One of the co-authors describes it as not that different from asthma. Do we need to change our perception? How much does that contribute to the overall problem, do you think?
I think it has a major contribution to, one, recognizing that it exists, diagnosing that it exists, and then also talking to the patients and their families on what the future will hold for them. Unlike asthma, obesity does have a huge psychological component, and that makes it really difficult for not just the patients, but even the healthcare providers to have the time to really discuss this. It's a chronic condition, just like asthma. However, it has a multifactorial contributions, unlike asthma, which are a little bit more direct and you can attack the problem at its origin. Obesity is going to have a lot of different solutions and unique solutions to each patient. So that makes it a much more difficult disease. But to treat it like a medical condition is the key. It is not a social condition. It is not just a psychological condition.
Yeah, this is certainly one we can talk a lot about, and certainly one that I'm sure we will. Dr. Sadhu, thank you so much for your time today. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.